There is a new food fad. Colostrum is the latest big thing being touted by the social media influencers, adding scoops of the powder into their drinks for ads. What is it? Should you take it? Does it have any benefits? I mean, you know, what you read online, is it always true? So for those answers, we bring in our 9 News medical expert, Dr. Payal Kohli. So what is this? I think I know now that you just told me in this commercial break.
So colostrum is the first form of breast milk. So it usually comes about 2 to 5 days after you've given birth, and it starts a few weeks before. And it's called liquid gold by a lot of people colloquially, because the idea of the colostrum is to really help the newborn populate their gut with antibodies, populate their gut with nutrients. And so compared to mature milk, which then comes later, it has a lot more fat, a lot more protein, a lot more vitamins and minerals. It has peptides, it has immune cells, it has growth factors. So the idea is for the baby to get everything that they need with an immature gut so that they can thrive in the external environment.
Okay, so that's for the baby, and
I was just going to say,
those
grown adults.
Those of us who've had kids know how important that is for kids to thrive. But when it comes to social media influencers and putting it into supplements, by the time it gets to a supplement,
so the way the supplement is even made, it's made with bovine or cow colostrum, right? Because you can't ethically make human colostrum supplements. So this is cow colostrum, which is different than human. And we can talk about that. There's also supplements of goat's milk colostrum and buffalo milk colostrum as well available.
Is one better than the other?
Yeah, so I mean,
More
obviously,
effective?
cow's milk is the most common one you'll find out there, and it's full of a lot of the same nutrients and vitamins, but the antibodies are completely different. So the antibodies found in cow's colostrum, when you eat those, your gut will actually digest the antibodies. They won't get systemically absorbed. So there's some science that they could have local effect in the gut because they just stick in the gut, basically. They don't get into your bloodstream. But besides that, it's not really the same thing as having human colostrum.
Right.
What does the science say here? First of all, I don't love that idea of a goat or a bison or a cow or anything. I don't like taking that stuff, but
Well, I don't love that idea either, especially if you're pregnant, if you're immunocompromised, because it could be contaminated with bacteria. It's processed very differently, so you certainly don't want to take it if you're in any of those categories.
Okay.
So who is this aimed at? Who should be taking it?
These are the people that
What's the
already look
benefit?
perfect. They're taking this, I think.
No, in fact, for healthy people, I would not recommend it. So there are some people in the guidelines who may benefit based on the science. So let's talk about the science. The science basically says for gut health in people who have inflammatory bowel disease or other types of gut problems like infectious diarrhea, it may help to repopulate the immune system in your gut because you're basically giving a bunch of passive antibodies, and there have been some positive studies there. For athletes who are trying to do heavy training, it may cause a little bit of boost in their immune system temporarily, nothing on the order of what vaccines and other things cause, but it may make you less likely to get a respiratory infection or cold. Now, if you look at the athletes who use colostrum, their exercise capacity doesn't look any different. They don't have more muscle mass. They don't have any of those differences, but maybe mild improvement in their immune health. So the guidelines tell us that there's only really some subgroups of people who should take it. Preterm infants, 100%. You know, especially if they can't eat, they need the colostrum to help protect them. And then those individuals with bowel diseases in consultation with the GI.
That's what I say, though. A doctor has to refer this, right? You shouldn't just self-diagnose and say, I think I need this.
No, I don't think so, Kim, because there's a lot of variability in the colostrum supplements out there. In fact, if you flip it over and look at the back of it, colostrum, which is liquid, gets dried and then it gets turned into a powder. So if they use high heat to dry it, they actually remove many of the bioactive compounds that are even there. So it's not just about whether you should take it, it's even about how it's prepared, and there's no regulation. So you could have the same manufacturer make 2 different batches of colostrum and they could behave very differently.
And as you pointed out at the beginning of the conversation, we're seeing a lot of this on social media and influencers, and it is fair to point out, important to point out that a lot of those influencers have partnerships and are paid for what they're doing.
Exactly.
So check with the doctor.
Always a good idea to do that. Yes.
And you can find more with Dr. Kohli at 9news.com/Dr. Kohli. You can check with her.